10 symptoms of stroke in men often overlooked. When a stroke strikes, every second counts. Turning lives upside down in an instant, this silent attacker can hit anyone, at any time. In this video, we'll uncover 10 symptoms of stroke in men often overlooked and reveal key signs that could save your life. We'll also dive into the main causes and how you can reduce your risk. You'll learn essential tips and insights to protect yourself and your loved ones from this silent threat. Before we dive in, please help us spread this life-saving message by hitting the like button. If you're new to combat heart disease, subscribe and click the bell icon to stay updated with our latest videos. And stick around to find out how to get 2 heart health-free gifts. We guarantee both you and your heart will love them. Now, let's get started. Number 10, sudden numbness. Sudden numbness or weakness on one side of the body, particularly in the face, arm, or leg, is a critical warning sign of a transient ischemic attack, or TIA, often referred to as a mini-stroke. This condition occurs when blood flow to a specific area of the brain is briefly disrupted, leading to temporary, stroke-like symptoms. According to the American Stroke Association, TIAs are responsible for 12% of all strokes. Recognizing these early symptoms is vital, as they can precede a more severe stroke. Immediate medical intervention can significantly reduce the risk of a major stroke, which occurs in up to 15% of patients within 3 months following a TIA. The specific symptoms can vary depending on the area of the brain affected. For instance, numbness or weakness in the left arm and leg may indicate an issue in the right hemisphere of the brain, which controls those functions. This underscores the importance of prompt action. Seeking emergency medical attention can be life-saving. Up next, we'll explore another subtle yet crucial symptom that often goes unnoticed, which can be equally telling of a serious health issue. Number 9, confusion. Confusion, accompanied by difficulty speaking or understanding speech, can be a vital indicator of a stroke affecting the brain's language centers, particularly the left hemisphere where Broca's and Wernicke's areas are located. These symptoms, often subtle and easily dismissed, are critical red flags for disruption in the brain's ability to process language. For instance, aphasia, a common post-stroke condition, affects over 2 million Americans, with symptoms ranging from mild word-finding difficulties to severe communication barriers. A practical way to assess for this issue is by asking the person to repeat a simple sentence, such as, "The sky is blue." Difficulty in repeating or understanding this sentence could indicate a significant problem. This type of assessment can help quickly identify if there is a stroke-related issue with speech clarity or comprehension, requiring immediate medical evaluation. Prompt action is essential, as early treatment can minimize brain damage and improve recovery outcomes. In fact, recognizing these early signs and seeking immediate care can reduce the risk of long-term disability. Coming up next, we'll discuss another often overlooked symptom that can provide crucial early warning signs of a stroke. Number 8, visual disturbances. Sudden vision problems, such as blurriness, double vision, or loss of vision in one or both eyes, can be alarming signs of a stroke. These symptoms occur when a stroke affects the brain regions responsible for processing visual information. Often mistaken for less serious issues, these visual disturbances warrant immediate attention. Recognizing that trouble with vision might be linked to a stroke can expedite necessary treatment, potentially preventing further brain damage. Stay tuned as we discuss a physical symptom that, while common, can be a clear sign of a more significant health issue. Number 7, trouble walking. Difficulty walking, sudden dizziness, loss of balance, or lack of coordination can all be subtle signs of a stroke. These symptoms are often attributed to other causes and therefore ignored. However, they may indicate that the stroke is impacting the parts of the brain responsible for movement and balance. Conditions like high blood pressure, which are risk factors for strokes, can lead to these symptoms. Paying attention to sudden changes in how you walk or balance can be crucial in early stroke detection. Next, we'll highlight a symptom that's easy to miss but can indicate a significant underlying condition. Number 6, severe headache. Headaches happen all the time and can come from lots of different things. However, if you suddenly get hit with an intense headache out of nowhere, This might mean something serious like a stroke is happening. During a stroke, something goes wrong with how blood gets to your brain. This messes up your brain cells because they're not getting what they need to work right. So when there's an awful headache involved, it usually means that the problem involves the blood vessels in your head, specifically the blood supply. Not every scary headache means there's definitely been a stroke, but checking things out fast helps figure out if anything else just as serious might be going on, and gets you started on fixing whatever that may be. There are several critical risk factors that increase the likelihood of men experiencing a stroke. High blood pressure, diabetes, and a family history of strokes are among the most significant. High blood pressure, or hypertension, poses a serious threat as it can damage blood vessels and reduce blood flow to the brain, significantly increasing stroke risk. Similarly, diabetes contributes to stroke risk by causing plaque buildup in the arteries, which restricts blood flow. A family history of strokes is also an important factor. If you have relatives who have experienced strokes, it's crucial to discuss and adjust lifestyle to identify other potential risk factors you might need to monitor. Understanding these key risks allows men to take proactive steps to reduce their stroke risk and maintain overall health. Let's continue this conversation with number 5, where we explore another vital symptom that often goes unnoticed. Number 5, sudden fatigue. Sudden, unexplained fatigue can sometimes be a silent warning of an impending stroke, often overlooked because it's associated with many non-critical issues. This kind of fatigue isn't just about feeling tired. It's a sudden and overwhelming exhaustion that doesn't align with your usual level of activity. During a stroke, disrupted blood flow can impact brain areas responsible for maintaining alertness, leading to unexpected tiredness. Recognizing this symptom early and seeking immediate medical attention can be crucial in preventing more severe consequences. What if a simple change in appearance signals a major health issue? Stick around as we discuss another symptom that might be hiding in plain sight. Number 4, face drooping. A noticeable droop on one side of the face or an asymmetrical smile is a classic sign of a stroke, specifically indicating a possible disruption in the brain's control over facial muscles. This symptom, known medically as facial palsy, occurs when the stroke affects the cranial nerves, particularly the facial nerve, leading to weakness or paralysis on one side of the face. According to the Centers for Disease Control and Prevention, approximately 87% of strokes are ischemic, caused by an obstruction within a blood vessel supplying blood to the brain. Facial drooping is often one of the earliest and most visible signs of such a stroke. It's crucial to distinguish this symptom from other conditions like Bell's palsy, which can also cause facial drooping, but typically resolves on its own. A quick and simple test is the FAST method: face, arms, speech, time. Ask the person to smile. If one side of the face droops, it's a sign to seek immediate medical attention. This facial asymmetry is not just a minor inconvenience or a sign of fatigue, but a critical indicator that the brain is not receiving adequate blood flow. Feeling queasy without a clear cause? This next symptom might surprise you with its implications. Stay tuned to learn more. Number 3, unexplained nausea. Feeling nauseous or vomiting without an obvious reason might seem unrelated to serious health concerns, but it can actually be an early warning sign of a stroke. This symptom can occur when a stroke disrupts normal brain function, affecting areas involved in regulating the body's equilibrium and digestive processes. It's important not to dismiss sudden, unexplained nausea, as prompt medical attention could mitigate more severe outcomes. Is a sudden blackout just a fluke, or is there more beneath the surface? Don't miss the next segment where we reveal another critical warning sign. Number 2, fainting. Fainting, or suddenly losing consciousness, can be more than just a momentary lapse. It could be an indicator of a stroke, particularly if it happens without any clear trigger like dehydration or standing up too quickly. Strokes can disrupt the brain's ability to regulate blood flow, leading to sudden fainting spells. It's critical to treat such episodes seriously and seek immediate medical evaluation to determine the underlying cause and prevent further harm. Before we reveal the top symptom, let's build some anticipation and give you a special treat. We're excited to offer you 2 fantastic free gifts to help you combat heart disease more effectively. First, we're offering our exclusive ebook, 7 Foods That Clean Arteries and Prevent Heart Attacks. This isn't just a list. It's a collection of delicious, heart-healthy recipes designed to help maintain stable blood pressure and promote overall well-being. Second, you'll get access to a groundbreaking video titled "The Shocking Cause of Cardiovascular Disease and What You Should Do Starting Today." This video explores a remarkable ancient signaling molecule used by our ancestors, offering fresh insights into how the nectar of gods could be the key to optimal heart health. To claim these two incredible free gifts, simply click the link in the description below. Now, let's get back to our countdown and reveal the number one symptom. It's a crucial sign you don't want to miss in the 10 symptoms of stroke in men often overlooked. Number 1, agitation. Sudden agitation, unusual behavior, or unexpected emotional outbursts can often be overlooked as signs of a stroke, particularly in men. These symptoms may arise when a stroke impacts areas of the brain responsible for regulating emotions and behavior, such as the frontal lobe and limbic system. A stroke can disrupt the normal blood flow to these regions, leading to abrupt and significant changes in mood or personality. According to a study published in the journal Stroke, approximately 30% of stroke survivors experience substantial mood disturbances, including depression, anxiety, and emotional instability, as a direct result of these brain changes. These mood disturbances can manifest as sudden irritability, confusion, or even inappropriate laughter or crying, which can be misinterpreted as stress or a bad mood. It's crucial to recognize these symptoms as potential signs of a stroke, especially if they occur suddenly and are out of character for the individual. Such behavioral changes warrant immediate attention, as timely intervention can prevent further damage and improve recovery outcomes. And there you have it, the 10 symptoms of stroke in men that are often overlooked. We'd love to hear from you. Have you or someone you know experienced any of these stroke symptoms? Are there other symptoms or signs you think should be highlighted? Share your thoughts and experiences in the comments below. If this video has offered new insights or reinforced your current health strategies, please support our channel by liking the video, subscribing to Combat Heart Disease, and hitting the notification bell to receive updates whenever we post new content. For those who want to go the extra mile, the Super Thanks feature is a wonderful way to help us continue sharing valuable health information. Don't forget to check out the 2 exclusive free gift links in the description below. Remember, your health is in your hands. Thank you for watching. Stay vigilant, stay informed, and here's to your health.